meeting to order. Since it's the first meeting of our new term, we'll go around and introduce everyone as we did during the last meeting. So why don't we start right here,
Sure.
Mr. Brewski.
Nathan Brewski, I represent South Colony and Loudonville.
Patty Lockhart, I represent the Village of Colony.
Just a staffer.
You can share your name.
Christian Barnes, Director of Research for the Minority.
Arne Zilgme, Minority Council.
I'm Luke Rogers. I'm kidding. Mike McLaughlin, County Exec's Office.
Berora Fekoro for the 7th Legislative District.
Carolyn McLaughlin, no relation. First district in the South End office.
To Mike or Lucas?
Burton Simpson, second legislative district, Arbor Hill, West Hill, Sheridan Hollow, and Washington Park.
Jeff Burley from the 31st District, which is Western Guilderland, Altamont, most of Knox, and part of the town of Bern.
Vicky Cleary, 32nd Legislative District, McCownville, Southern Guilderland by the Country Club of Kenwood.
Curtis Kennedy, Majority's Office.
Brandon Russell, Deputy Majority Counsel.
Frank Camiso, 11th District.
Sam Fine, 6th District, Chair of Social Services Committee. Okay. So number one on the agenda is approving previous minutes. Motion to approve.
Motion.
Mr. Camiso. Second, Mr. Brewski. All in favor?
Aye.
Opposed? Passed unanimous. Next on the agenda, number two, authorizing agreements with the New York State Office of Children and Family Services and Brightside Up, Inc. regarding registration and inspection services. Commissioner McClave?
Good evening. Yes, we're looking for approval to enter into a memorandum of understanding between New York State Office of Children and Family Services, Albany County, and Brightside Up. Brightside Up is a sole source New York State selected provider for doing registrations and inspections of child care facilities and family daycare centers in Albany County. And this is 100% federal funding that is passed through the state, through DSS to Brightside Up. And they will receive an amount up to $233,000 for these services.
Great, thank you. Are there any questions from the committee? Ms. Lockhart?
Commissioner, it's just a name change, right, between the Coordinating Council?
Yes, it used to be the Capital District Child Care
Right.
Coordinating Council.
Totally same thing, just
Same
changing.
organization, yeah.
Thank you.
Are there any other questions? Mr. Chamisso? Motion? Second? Mr. Cleary, all in favor?
Yeah.
Aye.
Opposed?
I like the other.
Passed unanimous.
It is easy.
Number three on the agenda, authorizing an agreement with Nano Nation regarding the provision of kiosks for SNAP benefit applicants and recipients.
Yeah, so we're looking for authorization to enter into a contract with Nano Nation to provide 4 kiosks for SNAP processing, processing documents for SNAP eligibility. 2 will be at the DSS office on Washington Avenue. 2 will be in the community to be determined. We did an RFP for this service. Nano Nation was the sole respondent. So we're looking for authorization to enter into the contract with Nano Nation to get those up and running. And we're also looking for authorization for appropriation of $102,000, which is coming from, it's federal money that's coming through OTDA that we can appropriate for this purpose. We have previously had an $80,000 appropriation for this activity, and New York State came through with an additional 102 to support the full cost of operation of the 4 kiosks.
Happy to hear that. Ms. Lockhart?
Commissioner, my memory serves me right, did we try this already in the community with some kiosks? Did we? Or at DSS?
We had talked about it previously.
This is that same process.
It's the same one, but we never
It's
actually...
taken a while.
Okay.
No, that's how long it's taken.
Yeah.
Okay, wow.
So
Okay.
we're close now.
Okay. What's close?
What is close?
Well, hopefully, I mean, the intent is hopefully to have the kiosk up and running by the summer of 2020. we have a quick turnaround on this, so we have to work with once we get the contract with the vendor, they have to do some work with the New York State,
Right.
OTDOT to get some linkages with them for the documentation.
I thought we were doing a rollout pilot first, that's why I thought. So we're just gonna go full
Well,
blown?
we'll have 2 kiosks at DSS first.
Okay.
And the community will be later. This is Erin Stackowitz, Deputy
Yes.
Commissioner at DSS.
Thank you, Commissioner.
I don't want to give her a different job.
Mr. Bruschi.
Ms. McClay, can you help me think through like how these kiosks work? Like, one, how they collect this data, and two, it sounds like they also have to have a lot of very personal items with them. Like how I guess these kiosks will be placed such that carrying all those documents will still be quite secure for those that are trying to get SNAP.
Well, they currently bring them into DSS right now, or mail them in or fax them to us. So this will give them an opportunity to come into our lobby area and not have to talk with anybody at DSS. They'll be able just to scan them through the machine and get a receipt that they had scanned them for the date and time. And an identifier will be on the receipt. And then they just take their documents back with them. Right now, what happens is they come into the office, wait in line, there's always a line, and they have to see someone who will take the documents, make a copy of the documents, and write out a receipt that so we're hoping for people to save some time. I don't know if you want to add anything to how it's going to work.
So the documents themselves will not be housed in the kiosk itself, it'll be electronic feed into a system that will contain those. We're hoping that they'll go into the state image depository that OTDA has in place, so that's where all the documents will be housed, because we're required to keep them in this IEDR system. So it'll be electronically fed up there.
Ms. McLaughlin?
I guess what I've read in his question was there's a secure area where the kiosks will be set up so that their documents may not be compromised while they're standing there putting it in.
Yeah, in our reception area, we have 2 kind of cubby holes that the kiosk will be placed in. Or if we decide we don't like them there, we can move them inside the reception area in a private space.
There's also security.
There's security at DSS, yeah.
And to build on Ms. McLaughlin's question, these are going to be only during certain hours of the day? Are these a 24-hour system? Like, how is this going to work?
Well, at DSS, it will be during our operating hours, which is 8:30 to, well, the reception area is 8 to 4:30. So they'll be able to come in anytime during that time period. And in the community, we haven't quite figured it out yet. It will obviously have to be in a secure place like a library or something like that. So it will be according to the hours of operation of that facility.
So the kind of the first thought here is let's get the line moving faster, and then let's try to expand access by having it in more places.
Yeah, and have people not have to spend time in DSS that they don't need to, if they're just dropping documents off.
DSS has done a lot of things recently to get a lot of the activities that had previously happened at DSS out into the community, because what we found is that nobody wants to go to DSS, and rightfully so. It's not a fun thing to do. So by having employment services, things of that nature out in the community, sometimes at employment service providers or wherever, you get a much better turnout rate, compliance rate, and frankly, I think people are more successful with the program.
Mr. Burley?
Would consideration be given for the units that are going out in the community to place them in places where extended hours for people for whom it would be a real onerous?
Yeah, for
during the day?
working people.
Right.
Or people with odd hours, night shift people or whatever, I don't know. I mean, they could be able to come in during the day, but it will have to be in a secure place, so it will have to be some other kind of public location that has other people around.
Right.
So it's only gonna be based on whatever that facility's hours are. But we could have it up to 9 o'clock at night. I mean, assuming a library could be open till 9 or 10 o'clock at night.
Mr. Smith?
I'm not on the committee, but I have a question about this. Is there a way to, since you're gonna roll out with this, is there a way to do SNAP and heat and healthy neighborhoods and put all the packages to get, where they fill out one application?
That would be the ultimate goal,
Tells them what they're eligible.
There are other DSSs around the state that are doing it for more programs than SNAP. This happens to be federal funded through the SNAP program. So we must use these funds must be used for the SNAP program only. Now, but if this works and the kiosks are successful, we can see that we could somehow expand this to the other programs. And sometimes people have SNAP and other benefits at the same time, so we could potentially use this legitimately
One-stop shop.
for those people that have both SNAP and Medicaid, for instance, or something like that.
Thank you. Good question. Are there any other questions from the committee? Motion approved. Mr. Bruschi, second. Second, Mr. Camiso, all in favor?
Aye.
Opposed? Passed unanimous. Okay, number 4 on the agenda, authorizing an agreement with the New York State Department of Health regarding reimbursement for administrative costs pertaining to the early intervention program. Commissioner Gahagan?
Yes, good evening, everyone. The department requests legislative authorization to enter into a contractual agreement with the Department of Health for the provision of early intervention services to be able to claim for administrative costs associated with the administration of that program. Early intervention is a mandated program that the county does need to provide. It's for infants and toddlers 0 to 3 years who've been identified with a disability, whether it's speech, whether it's in need of physical therapy, whether it's in need of social work services. So being able to provide those services, the idea being, you know, as it says, early intervention, if we're able to be proactive in providing those services upfront and sooner, hopefully then they would be able to get more aligned with where they need to be developmentally. So the department is requesting legislative approval to be able to contract to be reimbursed for the administrative costs associated with that.
Thank you. Are there any questions from the committee? Mr. Burley?
Just more comment, Hi, Commissioner. Two of my children received early intervention services through the county. One, it was determined an assessment wasn't necessary. The second one actually received services, and it was incredibly successful. So I'm a big advocate for the program, and it's also very well administered by the county as well.
Thank you. I didn't pay him.
Are there any other questions from the committee? Hearing none, motion approved. Mr. Cleary, second. Mr. Burley, all in favor?
Aye.
Opposed? Passed unanimous. Number 5 on the agenda, authorizing an agreement with Cayuga Centers for the provision of functional family therapy therapeutic case management services.
Yes, so Cayuga Centers is currently one of our contracted entities for the provision of clinical services. They reached out to us because they applied for a RFP in which they received $500,000 in grant funding. In the RFP, they proposed specifically to work with Albany County to provide the functional family therapy therapeutic case management service. And in essence, what this is, it's targeted at older teens and working both with the youth and the family in terms of whatever concerns or issues that have brought them to interface, in particular with the juvenile justice system, in order to be able to address those concerns. As you can appreciate, being able to have this program is quite timely with the Raise the Age as well as with the changes in PINS legislation. And so if approval is given to move forward with being able to have an agreement with them, what essentially would be the requirement of the department is just to make the referrals to the program, because again, it's all going to be covered through the funding that they have received. And so it will certainly be a key resource and tool for us in terms of just being able to expand our programs and services to address the Raise the Age as well as PINS youth. And so that's who we would target with this program.
Okay, thank you. Are there any questions from the committee? Hearing none, is there a motion to approve? Mr. Atakoro, second, Ms. McLaughlin, all in favor?
Aye.
Opposed? Passed unanimous. Number 6, amending resolution number 378 for 2019 regarding the provision of prevention services and supervision and treatment services for juveniles.
Yes, so this is for the agreement with probation department. In the previous RLA, we did not include the Raise the Age funding, and so the current agreement does not, the current resolution does not account for the full totality of funding, and so that is the reason why we are having this additional request, is to be able to address that initial resolution so that it accounts for the full totality of funding, which would be inclusive of our current prevention funding and in addition to the Raise the Age funding that was approved through the Raise the Age plan that the county submitted to the state.
Thank you. Are there any questions from the committee? Hearing none, is there a motion to approve? Mr. Camiso, second. Mr. Cleary, all in favor?
Aye.
Opposed? Passed unanimous. Okay, moving on to the last item on the agenda, number 7, authorizing an agreement with the Research Foundation for the State University of New York regarding the New York State Supervision and Treatment Services for Juveniles program.
Yes, so again, as part of the array of programs and services that we have to work with those youth that are interfacing with the juvenile justice system, we have had historically an agreement with SUNY because it allows us to be able to track outcomes in terms of the programs and services that we are providing for juveniles. So, you know, we're able to track in terms of the numbers, are they declining, are they increasing in terms of how many are going into detention, how many are going into placement, in terms of, you know, the community-based services, how the goals in terms of have been identified, are we meeting those? And so that is the request for this RLA, is to be able to continue that contractual agreement with SUNY to have that research component. As you can anticipate, being able to have the data really informs then how we continue to move forward and what programs and services we need to invest in.
Great, thank you. Are there any questions from the committee? Mr. Bruschi?
Commissioner Geohagen, is that?
Gahagan, close.
Gahagan. So I'm curious, when we deal with the Raise the Age plan now, that's happening. What do you anticipate, like the major kind of strains would be on these public systems that you would expect a research plan like this to find? Like I'm kind of curious, as we cease to look towards the prison system as a tool for change. Like how would we guess that this one band of age group would then kind of get that treatment, get that local intervention back out into society? What would you expect to see here?
So certainly in terms of just tracking, are we being effective? Are we actually mitigating youth from further penetrating into the juvenile justice system? So the idea being that if we're implementing these programs and services, are there going to be any rearrests? Is there any escalation in terms of, the crimes and behaviors that are happening? Looking at lengths of stays, are we able to decrease the length of stay in terms of if a youth does have to go into detention or into placement, are we able to look at how we are able to decrease that? And so in terms of the research, it's analyzing, the different aspects of those programs. So each time that someone presents a program and service, there are outcomes. 90% of the youth will not be rearrested. 100% of them will show up to their next court appearance. So then we have those outcomes, and so then we're able to track, are they meeting those outcomes? Is that the right program for this group, or do we need to take a step back and look at going in another direction?
Also keep in mind the impact of Raise the Age crosses many county departments, TCYF being one of the primary, but we're having major impacts from probation, Department of Law. Obviously, we have involvement with the regional juvenile detention facility, and Raise the Age, bail reform, all of the criminal justice reform that's happened over the past couple of years are having massive impacts on all of those processes. So this just studies this one aspect of what is a much larger and overarching impact.
Great. Ms. McLaughlin?
I would just like to know, does this study in any way impact the disparity in numbers as it relates to young people of color that are put into these type of services?
So thank you for raising that, because that is one of the other areas that we do track in terms of, youth of color and who is involved, who is interfacing with the juvenile justice system, and where are the points in which they're interfacing. And so again, we're looking at the numbers that are going in, the lengths of stays, do we see any difference in terms of the number of petitions that actually do go to court for youth of color versus non-youth of color. So those are all part of what's being tracked in this.
And do you think that the information will serve to change policy?
I would certainly hope so, and I would say that is the goal as well, is to be able to collectively look at this and to see if we can discern what are the contributing factors and the underlying factors as to why over the past few years we have been able to impact the system in that we see less number of youth going into further penetrating the juvenile justice system, but we continue to still have a disparity of youth of color. So while we are making positive growth in terms of less youth entering the system, we still have not really been able to move the dial in terms of the disparity. And so, it's certainly not just what we have with SUNY, but, comprehensively, whether it's OCFS or DCJS, there is definitely that aspect of the work across the board in terms of looking at the disparities along with the other touch points of the systems.
Mr. Bruschi?
Do you have a sense of how willing law enforcement is, or will be, to share the data that you need in order to make these findings stick? Like, have they pushed back in any way, or have you found that they've been very forthcoming?
I will say within Albany County, we've had a very workable relationship with APD. We have, and with the sheriffs as well. And so for some of the committees and groups, there is actually representation of both departmental as well as law enforcement. They're involved in a number of our programs and services.
Are there any other questions from the committee? Motion to approve.
If I could have a moment.
Sure, yes.
I just wanted to take the opportunity to say thank you to this group. Over the past 6 years, you have been very supportive to the department in the work that we do, and it has been very appreciated. I will be transitioning from my role here, and I'll be transitioning to the state, so this will actually be my last meeting. But I just... But I want to say thank you. Each time that I have come to this table, I have felt the support, and I speak on behalf of the department in terms of the programs and services and the value in terms of, the impact to children and families. So just wanted to say thank you for that.
Thank you.
Good luck.
Thank you.
Thank you.
I want to thank you, and I think we're all going to be sad to see you go, but congratulations on your new position. Appreciate you taking the time to thank us.
Thank you.
Motion to approve? Motion adjourned?
Approve. Wait.
Mr. Cleary, all in favor?
Aye.
All opposed?
Family functional.
Motion to
I was
adjourn.
gonna ask